Today's medicine is a big one. It's carcinosum, which is a cancer miasm a nosode. Sorry, and it's got to do a lot with miasms and stuff, but I'll get into that. A nosode prepared from breast cancer by Falbister, a homeopath back then, very good one. It is claimed the carcinosum acts favorably on and modifies all cases in which either a history of cancer can be elicited or symptoms of the disease itself exists. So, um, you this is where this comes in. This is like a cancer nosode made from breast cancer. Yeah, from the discharge of breast cancer, and it's great for anybody who has a history of cancer in their family, mother, father side, whichever, both sides, whatever it is. That history of cancer is the miasm being passed on. We would say genetics. What would they say now? But anyways, a miasm, a hereditary predisposition to being susceptible to a disease. So you're predisposed to get diseases, sickness. It can be lung stuff, can be cancer stuff, it can be a lot of stuff. But this one here uh, is basically it'll modify all that, you know. So in other words, you have a history of cancer. Now you're not just going around. Everybody has a history of cancer. A lot of us do. Whether an aunt, I know my aunt, a couple of my relatives, but you're not just running around giving carcinosum. So what you're doing is you come in as usual, and you're looking at the case. There's something on top. Usually there's something there, and you give some medicines and remove a layer to, they have a grief layer, they have an injury layer, had a car accident, they're having mental issues in that or whatever from it. You give arnica, some nat sulf to them, and it clears that stuff up. That layer peels off. You may see the cancer symptoms underneath, or you could see someone who has the definite cancer symptoms, cancer miasm symptoms, or the remedy symptoms. And I'm going to go through all them symptoms now. But it acts favorably in anybody who had a history of it. They inherited this miasm, which probably a lot of us have. But until you see it, you don't treat it. If you right away see that all the symptoms I'm going to go over, you think that could be the medicine. You can't hurt them by giving it to them, but well, you could wake up that miasm and cause their symptoms to be worse. So you definitely got to be careful there. But you go in with this carcinosum if your case is confused. You're given sulfur for skin stuff. You're given, some tuberculosis, lung stuff, antimonium tarp or something, because it's indicated, and you're thinking, man, this is so confusing. There's so many different things here. And this is for one that has multiple miasms, which by now a lot of us do. And then when I talk about that, it's like psychotic miasm, syphilitic miasm, tubercular miasm, sora, all that kind of stuff. So anyways, psoric miasm. I don't know if I said that one. And then, of course, the cancer miasm. Now, this is why is everybody getting cancer? Well, there's a lot of different things that contributed to that, and that's what the body's reacting to. So, this is one principal nosode of cancer and is also one of Burnett's preparations. So, Burnett prepared this first one to prepare. Clark used it more frequently than any other miasmatic remedies. And like I was saying, like Serenum is another. There's a lot of them. There's a few of them. Burnett had a number of different cancer preparations and followed his instinct largely in their use and selection. Okay, Burnett used it in treating depraved inherited conditions in children. So, conditions that they inherited from their children, from their parents. This would help, such as infantile self-abuse, which is masturbation, with good effects. You don't think you can, anyway, you don't think you can inherit that, huh? Which Clark has confirmed. So Clark confirmed that these children want to masturbate. And this is a miasm, that's not a normal state. Clark had met with a suicidal tendency in several cancer patients. So suicides in there, that'd be Arum metallicum, a few other ones. so that the cancer nosodes may be appropriate in mental cases, especially when the hereditary points that way. So it points towards these mental situations. There's OCD, there's a lot of different things going on with the mental there. Cancer of the breast glands. So the glands of the breast cancer with great pain and induration, hardness of glands of uterus. So in that case, you would definitely go in and consider carcinosum for that. The offensive discharge, so whether it's the sweat or from the vagina or from the mouth or from these different areas, these it has a offensive discharge. Hemorrhage, which is bleeding and pain. Indigestion, accumulation of gas in stomach and bowels. Rheumatism, cancerous cachexia. So the cancer miasm, of course, is what this is. This is a cancer nosode, carcinosum. Wiped out the C with my finger, picking that board up, I'd imagine. But carcinosum is a cancer nosode. Carcinosin, intercurrent. So when I say an intercurrent, that means, you got a case, it's confusing. You're trying this medicine, it doesn't fully work. This medicine doesn't work, and you just can't get a total good picture of this case. There's contradicting things. The symptoms and things change places. There can be multiple miasms, tubercular, these different miasms will be in there. You would consider, let's give a dose of carcinosum. Now, you're not going to know, it may bring up their energy, things like that, but you're not going to know if it worked until you give the indicated remedy that you think it was. And if that remedy kicks in now and works, you know it worked as an intercurrent. And there's a few medicines you can use as intercurrents, but contradicting and ulcerating states. No, alternating. I wiped that A out too. Contradicting and alternating states. So that's why I say, they're better by cold air. They hate cold air. This is, yeah, it doesn't match. So when they're when they're contradicting like that and then alternating, they one day have lung stuff, the next day they have joint stuff, yeah, the next day skin stuff. So it alternates with different symptoms and different states. Basically, states are a miasmatic. A tubercular state, which is lungs, a sulfur state, which is skin, serinum, any one of those things for the skin. It keeps alternating like that, and it's just confusing. You give a dose of carcinosin, that could blow the case wide open, and you would know, okay, this is now you'd see a clear picture, and you'd be able to prescribe accordingly. Cancerous affections. So anybody that has a tendency towards cancer, and cancers, of course, those are all threes. Better open air, weather extremes. So they're better on weather extremes. They're better in thunderstorms. Worse, warm room. Although with rheumatism, when before the storm hits, they have a lot of pain in that. That's some people that can say, "Hey, there's a storm coming." How do you know? Well, my joints are aching. Night watching. So night watching is taking care of an adult, a child, an old elderly patient, a parent, nurses that have to be up all night work, and even night workers. Anybody up at night and they get sick from that carcinosum. Emotional shocks, any kind of bad news, things like that, a grief and things. Sex abuse. So anybody that's been under sex abuse, you would consider carcinosum would be in that picture somewhere. You might have to peel off some things like injuries and different things like that. But even the mental stuff, you might have to peel off some mental stuff and then get to the carcinosum. Vaccinations. So any vaccinations that basically damage the person. A lot of these vaccinations, people aren't susceptible. My parents get all the vaccinations and they're 90 years old. So is there a problem with vaccinations? They say it set up a lot of these other diseases, but you can take care of it with carcinosum. But people that's taking the vaccine, man, they're healthy, they're they're doing fine. You know, when I took the vaccine, oh man, knocked the crap out of me. I'm because I'm not used to it. My folks are used to these vaccines. Their body's like, yeah, bring it on. I'll eat them vaccines for breakfast. My body was like a little sissy. um, Okay, so mind overextended themselves. So these people, they're overdoing everything. They just keep going until they're just like burned out and they get miserable because of it. Desires travel. They want to keep going. They want to move. That's probably that overextending themselves. They can't just sit still. They're always got to be moving. They want good music, dancing. They like dancing and music. So this is good for fastidious. They're very fastidious. You know, they got everything got to be right. That's what it's OCD. They got to touch things 3 times before they can enter a room or something. Fears getting cancer. So there's that fear there that they have. And they love thunderstorms. They don't like when the weather's coming on. It causes them to ache, but they love thunderstorms. And this is also good for autism, you know, children that have autism. And there's a debate whether it's coming from the vaccines, that autism. So who knows? You know, I'm not here to uh, decide that uh, thing. You know, if you take a vaccine, go for it. If it hurts you, try it. You know, might come to a homeopath and get some carcinosum or something like that to overcome that injury. Flatulence, that's a 3. Burning pain like fire in the abdomen, that's a 3. Pains worse, 4 to 6 p.m. Phosphorus has this too, and they love thunderstorms also. So phosphorus, you'd be given, so here's what a lot of times going to happen. You're given phosphorus. They love thunderstorms. They got all the other phosphorus things, 4 to 6 p.m. You're given phosphorus, it's working, it quits working. You know, so you go up a dose. You go from a 30C to a 200C. So you go up to this 200C and nothing's happening. Okay. You can even try going lower. Sometimes lower is the frequency they need because these are all energy medicines. So you go lower in the frequency, doesn't do nothing. So higher, lower, doesn't matter. Same remedy. You might even try another remedy. Maybe it's phosphoric acid, you know, which has phosphorus. So you try another remedy. Nothing's working. Okay. A dose, this is where the intercurrent comes in. A dose of causticum can come, I mean, carcinosum, sorry, can come in and can open up the case. And now you go back to this phosphorus 30C and it starts working again and it stops working. You do a 200 and that 200 works, you know, and you can go up to 1M or whatever. But usually, you know, you'll get through that. It's usually an acute when you start getting up higher. When it's a chronic thing, a lot of times you want to go lower because you don't want to, um, you know, this person's had it for a long time. You don't want to knock it out too quick and aggravate the crap out of them. So you start lower and you work your way, you know, you work through that layer like that. What is this? Spondylitis, which is inflammation and arthritis of the bones and all that in the joints. Pain on right, no, that's not a 3. Pain on right side of neck. Now this can be the thyroid gland because this has a lot to do with the thyroid gland, just like tuberculinum would also be for the thyroid. Turning head. So the side of the neck is there's pain when you turn the head on the right side. Pain on right lumbar. And I always say that, you know, people say, I woke up, my neck was stiff, man. I couldn't. Well, that's, you know, you got something going on there. You just can't say I slept wrong. Pain in right lumbar region. So a lot of right sided pain here in the back. Swelling in the Achilles. What do they call it? Not the Achilles. Um, the glands under the armpits is what it is. Oh well. Anyways, I'm trying to say that word, but I can't. Swelling of the Achilla. Where's that back? Breast twisting, this chest. Axillary. That's why I don't have it spelled right. The axillary glands, which is under the armpits. Those glands are all swollen. There was so much air writing it down. I screwed that up. Swelling of the glands under the armpits, anyways. Oppression, constriction in the chest. Tuberculosis. This is, you know, good medicine. It could be for tuberculosis if the other symptoms match. You might even want to consider the tuberculinum nosode compared to the carcinosum. nosode. Boils inside the ear, otitis media, which is an infection in the ear. The ear feels stopped up. Okay. Eyes, soreness, that's a 3. Bluish tinge or spots on the whites of the eye, the sclera. Blinking, they're always blinking. That's a 3. That's bluish is a 3, and the soreness is a 3. They got a stinging sensation. I would think of apis if I heard stinging pain. That's the keynote of bee stings, bee venom. Lymphoma on the left side of the eyes. So there's a cancer type of thing on the left side. Oh, sorry. No. Lymphoma on the left side of the chest. I got that mixed up. Sorry. So that's that stinging, blinking, bluish tinge, and soreness for the eyes. This lymphoma is on the left side of the chest with the swelling of the glands under the armpit and the oppression and the constriction. Along with some tuberculosis, they could have tuberculosis going on, which would be coughing up blood in that. Acne, good for acne in the face. Herpes, upper lip and nose. So there's that herpes simplex coming out. Brown spots, that's cafe au latte, they call it. These people got these big, larger brown spots, so they call it a birthmark almost like. You would consider carcinosum from these, just knowing they have a birthmark like that. Paralysis of the face. Ticks, anybody that has, ticks in their face, you would consider carcinosum. Menses are frequent, early. They have tumors and cysts and fibroids all in the vagina down there. Tumors again. Let's see, cancer of the female organs. You would consider carcinosum. Appetite alternates. It's either capricious, they're picky, or it's ravenous. They're just going to eat anything. Desires chocolates, fat, spicy, soups. Desires food that makes him worse. So there's a couple medicines that have that. They eat things that they know is going to make them sick. But these desires in that will help you to differentiate between other medicines. Because a lot of times what we desire will be reflected in that medicine, and it would say, oh, some don't like spicy, they like just sweet. Some don't like fats make them worse. Now fats probably make this one worse, but they desire it, and then they get sick from it, or they get sick from eating too much chocolate or too much spicy food. Tired feeling with headache, worse. Headache worse from injuries or pregnancy. So if a woman has a headache, they got a tired feeling, they got this headache, and they're pregnant, whether it's during the pregnancy or after the pregnancy, that never well since they keep having this headache, you would consider carcinosum. And especially from a head injury, these headaches with this tired feeling, nat sulf, arnica, these ones would be considered along with carcinosum. If not, nat sulf's not working or arnica's not working, you're trying these things, you're going up in potency, this and that, you would consider carcinosum for that head injury. And then it might break it open. Then you'd go back to nat sulf or arnica. Throbbing in brain. The brain aches. They got an aching sensation in the brain. This goes to the other one, right? Yeah. Constriction of the chest, grasping at the chest, palpitations from 2 to 6 p.m. I don't know what other medicine has that from 2 to 6. I'm sure there's a couple. They sigh a lot. They can't, and the breath causes palpitations in the heart. So there's a lot of breathing stuff, but they're grasping the chest. They got palpitations in the heart. They're sighing. They can't breathe. They can't get their breath. And that causes the palpitations to be worse. Urination is frequent and voluntary at night. So people wet in their beds and that. Nephritis, which is an inflammation of the kidney with a kidney disease. So they got this kidney disease going on. The carcinosum could be one considered. And there's a few other remedies. And if they're not working, these ones that you're going for with this nephritis, you might want to consider carcinosum to break it open. Then you can see a clearer picture, and that's always what carcinosum is very good for, clarifying the picture. If it's all confused, you can't really choose the right medicine, you try a dose or two of this, and then you go back to your medicines. And if these medicines kicked in, that intercurrent, which was carcinosum, worked. Eczema, rheumatic joints, so skin stuff, rheumatic joints. And I always say, if you have if you have skin stuff, you put something on it, it goes inside, your joints get affected, your organs get affected. You could have asthma now because of it. Then you give a remedy that clears up the asthma or the joint pains, and now you got the eczema back. You keep giving that remedy until the eczema leaves, exit, and is gone. Sciatica, it doesn't say which side, left or right, but any sciaticas, warts, varicose veins, liver hepatitis. So now we're going through this hepatitis B shot, and that's why I said yesterday, I said, we wouldn't, we might treat the mother, before they're pregnant or what, if you were treating the mother for hepatitis B. Now you wouldn't have to worry so much about the child because it would clear it up in the mother. Now, if the mother was pregnant and you could start her on some medicines for hepatitis B homeopathically, um, very safe and effective, and then you can continue to treat the child afterwards to stop them from having any liver problems. Enlarged and weak liver, cirrhosis of the liver, could be alcohol, could be anything. Hereditary cirrhosis, you could have hereditary cirrhosis. So the parent was an alcoholic, drinking, bad liver, you could inherit that same liver function. Deep desire to breathe, that's a 3. So that's why I say this breathing is causing their hearts to palpitate. They're having a hard time getting it. Asthma, bronchitis, cough, worse talking. That's an interesting symptom there. Laughing, yawning, undressing, the cough's worse from all this stuff. So this can be a picture of a lot of different remedies, So anyways, you give carcinosum, the asthma clears up, you might get skin stuff. You keep clearing up the skin stuff, now the asthma never comes back. Or the bronchitis. Someone who's always prone to bronchitis, pneumonia, all these things. Sex drive increased. Condylomata, which is a sex disease. Masturbation, troublesome erections, and all this in a male. So their desires increase. They're really getting all worked up, and their erections are troublesome. They, what the heck? Man, I can't believe that thing's there again. But then they end up with this condylomata sex disease. Apathy, white patches and lumps. I don't know if you ever seen somebody with a white pus-filled sores on their mouth. You would consider carcinosum. And ulcers on the tongue, gums burn. Reoccurring sinusitis. Anybody having a lot of sinus problems, you consider that. Catarrh in cold weather. So when the cold weather comes on, they got a lot more mucus coming out. Hay fever, allergies, all this stuff can be carcinosum can be considered for. Black, dry, hard stools with constipation. That's a 3. Hemorrhage. They got bleeding from the anus. Hemorrhoids. And a prolapsed rectum. Moles, nevi, keloids, cafe latte, which is that brown birthmarks, they call it. Wounds, slow to heal. So any wounds that are slow to heal, this could help. There's, calendula, a bunch of them that can help that, but these wounds slow to heal, and so that they heal properly, carcinosum may be considered if they're healing bad, especially. Lupus, which is the immune system attacking the body. Ulcers, itching without ulcers with itching without. Anyways, bed sores. All right, breast swelling and tenderness before menses, breast cancer, whooping cough. This is under coughs. So breast cancer, tenderness of breast before menses, chronic fatigue, brittle bones, diabetes mellitus, hemiplegia, brittle bones again, huh? Mononucliosis, pneumonia, polyps, thalassemia. I forget what that is. Keloids, those are skin things. Vaccinations, tuberculosis. So this will help all those kind of situations. Hyperthyroid, goiter. So you're putting on weight. Your thyroid's not working basically, and they want to give you thyroid pills. You might want to consider carcinosum for that situation, but it would have to be an indicated remedy. Sleeps knee to chest. That's a 3. They want to, they sleep in a fetal position, they call it. Chronic acute insomnia. That's a 3. They cannot sleep, whether it's acute and it's just for time, short period, or it's a chronic insomnia from anticipation. So this anticipation is a big one. There's a test coming up. I had the job. I may get cancer. Some anticipatory anxiety. Anxiety in pit of stomach, so that's where they feel it. Heartburn, indigestion, malnutrition from additives, ulcers, cyclic vomiting. So every so often they have this, it could be every month or so they could have this vomiting. Decayed, that's a three. Decayed, hollow, the teeth are decayed, they're hollow, and they grind their teeth into sleep. Glandular rheumatic fever, where the glands will swell up and they have a high fever from it. That could be mononucliosis, pneumonia, this type of things. High fever, influenza, never well since. So they get influenza and they just are worn out. They never get better. The dose of carcinosum can relieve that situation. Enlargement of tonsils. So they got tonsillitis here. That's three. Pain, swallowing empty with no food or water in it. Chronic hoarseness. Rising from stooping, they get vertigo. 25, I'm still good. This is a very large medicine. I'm surprised I got through it as I did. Now, I let out a lot of stuff. I mean, there is so much to this medicine, but the key notes is they got bone problems. They got, confused situation. You just can't choose the right remedy. It's an intercurrent. It can be a great cancer remedy, but it can be an intercurrent when you're given remedies and they stop working, or the indicated remedy just doesn't work. You do carcinosum as an intercurrent in between, is what all that means, and that breaks the case open. Now you see a clear picture. That remedy, it may be the same picture of the remedy you were considering. That breaks it open. Now you give the indicated remedy, and it'll start working. So, and that's where I'm going through the miasm courses again, and that's where he said, this is where a lot of homeopaths have a problem. It's got to be this remedy. So this remedy's not doing it. They go to another remedy that could be indicated not working, and it's just like, dang, I just can't figure it out. I remember he said one time he gave 30 different remedies. This guy must have really he knew his stuff. He gave about 30 different remedies, I think he said, and then finally one worked. It was probably a lesser known one or something like that, but and then he said, he would usually zigzag between these miasms. He'd give some tubercular remedies when he saw that. He'd give some psoric remedies when he saw that, psychotic remedies when he saw that. And he said, he's giving these remedies zigzagging through all these different miasms that keep showing their head. He's not, yeah. Anyways, they're showing their head, and he finally realized, and Fat Tack and a couple other homeopaths he read about that said carcinosum breaks these things open. So he now he says, man, if I'm having a confusing case and nothing seems to be working, I give a dose of carcinosum, go back to the indicated remedy, look at that case again, take more talk to that person more and get some more symptoms, or I don't mean symptoms, but clarify the picture that you're looking at. What is this? What's going on here? And now give the indicated remedy that you consider, and it starts working. So he said that really, really opened up his, practice, I mean, his healing abilities. And Fatak, speaking of them, states a nosode prepared from carcinoma is claimed to act favorably. Right, act favorably, modifying the cases in which there is a history of carcinosum or the disease itself exists. So that was what he was saying. He said, he would, be trying these remedies and thinking, then it finally get from them, which they might have not known or not stated. Yeah, there was some cancer in my family, and when he knows there's a history of that, he goes to carcinosum to see if it'll break that case open. A lot of times you don't have to do that. He gives a medicine, it works. He gives a medicine, it works. He keeps working, and you want to keep it moving. So you're, peeling off the top layer. Then you go to the next layer. The top layer could be a grief. They lost somebody. The next layer could be they had a car accident, an injury. They, head injuries or knee injuries or something comes out, because you'll see old symptoms come back. This knee will start aching again. Man, that hasn't ached been aching for years, so when he knows there's a history of cancer in it, he'll go in and give that medicine to break it open if he's having troubles in any of those layers. Can be used as an intercurrent remedy along with the indicated remedy. So you can give that, like I said, you go in and you give that, it breaks it open, you give the indicated remedy, it starts working. This is the good remedy for children when you have many miasms in the case. So that's what I'm saying. He would deal with a lot of different miasms. This way, he was just given this and it was breaking that case open. A lot of stubborn asthma cases in children, worse from vaccination. Cases where nothing is working and you come down and they have cancer in the family, then this is the remedy. If cancer is on one side or both sides of the family, there may exist a cancer miasm. That does not mean that the child has a predisposition to cancer, so they don't have but they just have a miasm that's giving them all these symptoms. The children have blue sclera, blue spot or whites in the whites of their eyes, blue shading in the whites of their eyes. Sometimes that comes normally and goes away. Faubster studied 200 pregnant women who had cancer, and then he studied their children. The children had a tendency to birthmarks. So that's that cafe latte look on the skin. Carcinosum is another one that has deep pigmentation in children. Strawberry angioma, which is like an ulcer, a strawberry looking ulcer. This remedy has been used to prevent keloids, skin stuff. Faubster made an observation that people who lived under severe fear for long periods oftentimes need this remedy. People in war, like these wars that are going on, people that have been economically stressed out, whatever. Carcinosum is for sexual abuse and for abusive relationships. So anybody that's had that abuse in their life, which a lot of people have, you would consider carcinosum to help them through that. Major symptoms include chronic insomnia and all kinds of phobias. They have a lot of fears of everything and they can't sleep. Carcinosum is better or worse by the seashore. So that's why I say conflicting modalities there. Better or worse by the seashore. So, yeah. Worms, Down syndrome. So, for Down syndrome children, this could be good. Did that come from vaccinations? I don't know. There may be a history in a child of severe acute infections, especially whooping cough and pneumonia, and the child never totally recovered. So, never well since whooping cough, pneumonia, flus, any of that kind of stuff. You consider carcinosum. Their vitality never came back. This is a major remedy for glandular fevers like mononucliosis and chronic fatigue. Anybody going through that, some carcinosum may help you out of that. Carcinosum is better from naps, which is also a keynote of phosphorus. And phosphorus, as I said before, they love thunderstorms, and so does carcinosum. So you may eat carcinosum, maybe phosphorus may be an indicated remedy. You're given that, it's working, it quits working. You try a higher dose, doesn't work. You go lower and see if that works. Nope. Okay, you give a carcinosum in between, and now the phosphorus starts working. And I wanted to read this part. It says, this is also a remedy for that looks like many other polycrest remedies like sulfur, arsenic. And there's a lot of carbo-veg, calcarb. All these ones are polycrest remedies that have many uses, is all that means. And it looks like a lot of them. It's better dancing like sepia. It has cravings of cold drinks like phosphorus. There's phosphorus again. It has moles, birthmarks, and freckles like thuja. So all these are different miasms under these things too. It has the fastidiousness of arsenicum. They can't sit still. It also enjoys thunderstorms like sepia and phosphorus, I would say. Carcinosum is a remedy that antidotes the ill effects of vaccinations. Not everybody gets ill from them. My parents take them all the time and they seem fine. You know, Me, I took it and holy crap, that vaccination. My wife said, I'll never do that again. By the time we got in the car and was heading home, she's throwing up. I got chills. I'm sweating everywhere. Man, that was rough. It was almost worse than getting the disease because I did have COVID and that wasn't too bad. I worked 12 hours a day. But that day, man, we came home, we laid in bed and man, it was rough. But anyway, I forget what I took. I took some medicines to overcome that, but yeah, that was a rough time. All right, so that is carcinosum. Great remedy to get to know because it can break open cases. It can really help you through a lot of different situations, especially these children that are having effects from vaccinations. You might want to consider it for them. So that is morning medicine. You can age, but you don't have to get old. 5 minutes over. Wow, that's a big remedy.